Have you thought about how your journey this morning affected your health? Today, I want to explore how everyday travel shapes more than just where we go, how it can quietly build resilience in our health, our communities, and the systems around us. We'll begin at the national level, then zoom into Cheshire and to the kinds of journeys we make every day. And by the end, I hope to show that active travel can create ripple effects far beyond the trip itself. According to the World Health Organization, adults should aim for 150 to 300 minutes of moderate physical activity each week. But at present, a third of adults do not meet these levels. It is also one of the leading risk factors of non-communicable disease and death worldwide, which puts pressure onto our health systems. Here in the UK, inactivity costs the NHS around £1 billion every year, and over $7 billion to the society as a whole. We're also around 20% less active now than we were in the 1960s. And unless something changes, that gap is expected to widen. But it's not just about cost. We're also seeing a shift in how we live. By 2040, nearly 1 in 5 adults in England will be living with major health conditions. Life expectancy is increasing, but the age at which serious illness begins is expected to remain at around 70, which means we're looking at more years lived with ill health. But this burden isn't shared equally. It's shaped by the places we live and the opportunities we have to be active. So we might ask, we are living longer, but are we living well? Which brings me back to those everyday journeys. Think about your past week for a moment. Have you walked, wheeled, or cycled anywhere? That's what we call active travel. Simply put, it's moving under your own power to get from one place to another. Even small trips like this add up and can be a key source of daily physical activity. A few trips to the shops, a ride to work, visiting friends, going to uni. These journeys may look ordinary, but they matter. So how common are these journeys and who gets to make them? Well, over the past decade, levels of walking and cycling for travel have stayed fairly similar. If anything, they've fallen slightly. We can see here England, Northwest, and Cheshire. And in Cheshire, over the past results on participation over the past 28 days, cycling is at 4.5%, and walking 27.5%. So overall, participation is relatively low. But those numbers hide something else. Not everyone is equally likely to walk or cycle. As part of my PhD, I've been analyzing the National Travel Survey to explore walking and cycling for travel. And to give you just a few examples from the analysis of England. Now, these are results from regression models showing selected findings across different outcomes. Women were less likely to cycle, but more likely to walk. People without access to a car were more likely to walk and cycle. Those reporting poor health walked more but cycled less compared to people in good health when they participated. And higher income groups tend to walk less, while there was little evidence of an income effect on cycling. So we see that patterns vary across different groups. And these patterns, these differences, are shaped by wider factors, such as places people live. In Chester, where we are now, conditions vary from ward to ward. Our city isn't one single environment. As you can see here, levels of deprivation vary across the city, and those differences matter because they shape our health, mobility, and everyday opportunities. In some parts of Chester, people can expect to live 7 to 8 years less than in others because of where they live. So this isn't only about encouraging more walking and cycling. It's about making sure those options are realistically available in the first place. But within these different contexts, people are finding ways to travel actively. As part of the same PhD project, I'm also speaking with local residents in Chester about their daily journeys. One participant, I'll call her Sarah, often cycles to work and describes her experience. My head's clear. I feel alert when I get to work. It's actually quicker for me sometimes. What that shows is how active travel feels when it becomes part of everyday life. And I've experienced something similar myself, just in a very different context. I'm sure it hasn't escaped you that I'm not English. I grew up in Norway, where it was expected that I would walk or cycle to get around. And Norway isn't dramatically different in global terms. But active travel felt much more normalized in everyday life, something I only really noticed after moving to the UK. This is my mom, maybe 15, 20 years ago, cycling home with me and all our belongings on the bike while I'm taking the picture. I didn't grow up thinking of it as active travel. It was just how I got to school, to training, or band rehearsal. It was part of everyday life. Not something I chose, but something the environment made natural. If we zoom out from this, we can see that active travel is part of something much bigger. This causal loop diagram shows how it might work. At first glance, it looks complex, maybe even overwhelming, and that's the point. Our travel is shaped by a web of interconnected factors: infrastructure, urban design, safety, social norms, health, and policy. These factors don't act alone, they interact through feedback loops. So let me show you one example. When more people walk, wheel, or cycle, those journeys become more visible. That visibility can make streets feel safer, which gives more people confidence to take part. And as more people do, the cycle strengthens. But the reverse is also true. When almost nobody is visible on the street, it can feel less safe, and fewer people start. So that's how feedback loops can either reinforce progress or keep things closer to existing travel patterns. Other loops are longer. For example, more active travel can build public and political support, eventually leading to better infrastructure, and then again increasing active travel. So we see that it's reinforcing each other. So each part influences the others. So whether someone is walking, wheeling, or cycling isn't only about personal motivation. It's also shaped by the environment and the structures around them. So the takeaway here isn't to memorize every connection, but that active travel emerges from the environments we build. So let's come back to those everyday journeys. What actually happens when we choose to walk, wheel, or cycle? We move more, yes, we're increasing our physical activity, but it doesn't just change how active we are. Research suggests that active travel can reduce cardiovascular risk by around 11%, and cycling alone being linked up to 22% lower risk of heart disease. And just 30 minutes of active travel a day can cut to the risk of type 2 diabetes by up to a third. Beyond physical health, it affects our mental well-being too. People who walk, cycle, regularly report lower stress, better moods, and greater life satisfaction. And when enough people make those journeys, the benefits spread further. Quieter streets, cleaner air, and more connected communities. So what might a system look like? So here are some examples from Oslo and some of the surrounding areas. So in Norway, in Oslo, road space was gradually reallocated away from cars and towards walking and cycling, making those options safer, easier, and more convenient. As those conditions changed, more people began to move actively through the city, and as a result, the city center became more active and accessible. Over a period of 10 years, the city saw nearly an 80% increase in cycling. In smaller cities, such as Trondheim, targeted improvements like a new bridge with dedicated lanes led to an immediate 22% increase in cycling and a 21% rise in walking, because residents now felt the new route was safer and more pleasant than before. Closer to home, in parts of London, where streets have been redesigned to give more space to people with safer routes, calmer traffic, and better connections, walking and cycling have gone up too. In some cases, the likelihood of residents cycling increased by 64%, and walking increased, adding an average of 66 minutes to people's weekly routine. And these London programs, they increase their physical activity. But not only that, the health benefits of these programs are 10 times higher than the cost of building them, expected to save the public healthcare system over £1 billion over the next 20 years. So these changes aren't always straightforward. They can be debated and challenged. But the underlying pattern is consistent. It's not one intervention, but multiple elements working together over time. We must remember that these improvements don't automatically benefit everyone. Without careful planning, better streets and networks can still mirror existing inequalities, giving some people more access and safety than others. And that's why design matters at the everyday level. In my own experience, ski tracks ran alongside shared paths. So in this bottom photo here, this is my sister and I skiing from her apartment to my mother's apartment instead of taking a car. We had to run an errand and decided skiing was the best mode to use. So different ways of moving were built into the same environment. But it is still our choice to use them. If you look a little bit more at the numbers, one country stands out, the Netherlands. Around 27% of urban trips are made by bike. In England, it's closer to 2%. And that's not a small difference. In the 1970s, the Netherlands reached a turning point in how it thought about streets and safety, looking towards a long-term rethinking of streets and mobility, which led to decades of coordinated policy, planning, and investment. They combined infrastructure, safety measures, urban planning, and policy, all reinforcing each other over time, making active travel part of everyday life. So as more people are able to walk, cycle, or wheel, those choices become more visible, as we saw earlier, more normal, and easier for others to follow. While the environment shapes what's possible, the small choices people make within it still matter, because they're part of how the environment continues to change. So when you see 27% of trips by bike, you're really seeing the result of decades of systemic change. So yes, the structures around us shape what's possible, but what we do every day matters too. Even small decisions to walk, cycle, or wheel start to ripple outward, improving our streets, air quality, and communities, and reduces pressure on our health systems. And while systems can enable these choices, not everyone has equal opportunity. Differences in neighborhoods, income, and accessibility still influence who can take them up. And that's why designing streets and routes that work for everyone matters. Because the way we move through the world, the streets we have, the routes we take, and the environments around us shape how we feel in it. So this is a photo again, not far from where I grew up, with my mother and sister, me taking the photo. We're cycling home. It's connected to the same infrastructure that was on the skiing photo. So we built an environment that can make it for us to be active. So at the start of this talk, I asked you to think about the journeys you made over the past week. Perhaps the real question isn't just where they take us, but what they do for us along the way. Across Europe, nearly a third of car journeys are under 3 kilometers and half are under 5. In other words, many of the journeys we already make could be opportunities to move. So next time you're about to make a short journey, pause for a moment and ask yourself, could this be an opportunity to travel differently? Thank you.